Well, we have today Dr. Subhash Yadav. He is practicing in Meerut, Uttar Pradesh. And we also have the presence of Dr. Balbeer S. Verma, and he is practicing in Mauritius. Well, today we're going to be talking about BPH as it's a very pertaining, very important problem these days, and we need to talk about it. So, very welcome, gentlemen. So, the very first question I ask you, Dr. Balbeer, is why, according to you, the cases of BPH is on a constant and a high rise these days?
Actually, there is not a constant and high rise. It is more awareness.
Awareness, actually.
They were always there. So it is both way. Maybe our demographic are changing, but at the same time, because of more awareness and more availability of the healthcare facilities, we probably are detecting more problems than we were in good old days. So it's a combination of both.
Well, Dr. Yadav would like to ask you why it becomes very important for a BPH to be diagnosed at an early stage and not delay the process.
Yeah, because it can lead to a lot of problems. It can
Yeah.
lead to infection, stone formation. It can lead to your kidney damage. So it can lead to retention of urine. Your urine might be blocked. So you need to address it.
All right. So when we are talking about BPH, what are the major complication if there is somebody? Because in India, what is the tendency of a patient is until it's not over the head, we will not go to the doctor. And when they arrive to the doctor, it's already very late actually, but it's very hard to tackle the problem. What are the major and the severe complication a patient can have?
Look, the complications may range according to the duration of the obstruction that the prostate has produced. The commonest are repeated infections. Infection, you treat it, it comes back, or it doesn't really go, it just gets suppressed and you treat it again and it comes up again. They are recurrent, recalcitrant, multi-drug resistant infections which are difficult to treat until you hit at the root. And the root is the obstruction.
Right, right.
So infection is possibly, the Dr. Yadav will agree with me that infection is the most common complication of a prostate which is obstructing. Apart from that, one may have stone formation in the bladder especially. One may have development of the hernias in the inguinal areas because these patients are constantly and repeatedly straining to pass urine, which leads to an increase in the intra-abdominal pressure, which leads to hernia formation in due course of time. The other things are, when you have an obstructed outflow of urine, to compensate for the obstruction, the bladder has to produce high pressures to compensate and to still make the person pass through an obstructed channel. So it makes your bladder a high pressure zone. And we know that the urine has to continuously flow from the kidneys towards the bladder. And we also know by simple physics that liquids find it difficult to flow from a low pressure area towards a high pressure area. So there is a physiological block to the outflow of urine from the kidneys. So if we allow it to go on like that, there may be a kidney deficiency on the cards in due course of time. So we may end up in some degree of kidney failure and sometimes even in a florid and very obvious failure of kidney. So it's a whole range of things that can happen as we go forward with untreated problem of the prostate.
Which also makes it important for BPH to be diagnosed at a very early stage, as in when you get to know about the problem, you get it diagnosed as soon as possible. Well, Dr. I would like to know from you, when we are talking about the surgical interventions and of course the problem, what lifestyle modifications a person can opt for in order to tackle this particular problem? Any lifestyle modification?
He should not overload him with fluids. We should not hold urine for a long time. Suppose if he holds urine for say 4 or 5 hours, he might end up in retention of urine. So the small modification he has to do in his diet and he should consult his urologist and he should start small drug, alpha blockers we call, so that these symptoms are not increased. And in the early stage we don't advise surgery. Surgery is only advised when symptoms are not relieved with drugs. It's a small drug anyone can take in the night and can void urine comfortably. And when it is not relieved by the drug, only then surgery is required.
Well, Dr. Balbeer would like to ask you, at what age a gentleman should start observing for BPH in order to sustain a better life and not go to the critical part of the lives when it's too delayed?
Look, as a matter of fact, the enlargement of prostate is the part of aging process.
Yes.
It's just like graying of hair and graying of beard and loss of hair and wrinkling and you put on these spectacles. Same way, the males have the enlargement of prostate. And you would be surprised to know that it starts happening as early as late 30s and early 40s. The question is that it varies from individual to individual, and it is not always that everybody will become symptomatic of it at a particular age. So it varies.
So what are the first indicative symptoms, as in a person can get to know that now I
The
need?
first indicators are when your wife starts asking you, why do you get up to pass urine many times in the night? That probably is the first thing to click. So we call it nocturia. That means you get up in the night and pass urine. Then when you are in the office, sometimes you have to excuse yourself and go. Sometimes you spend more times on the urinal than usual. And sometimes you finish, and after a while you feel again that I have to go. So you have that what is called the sense of incomplete evacuation of bladder. You feel that I have not been complete.
Yeah,
So these are the early symptoms.
one need to follow.
Yeah, there are symptoms of storage and there are symptoms of voiding. The symptoms of storage are that you pass more frequently. That means you are not storing properly. You store a small amount and you have to evacuate. Or you have that urgency. You know, normally when the bladder is full, we have a signal here. But still we all have plenty of time to find a place in privacy. But when you are having the problem of prostate, it is a pressing need. If you don't find a place and privacy quickly, you feel threatened, you might pass in your pants. So these are the early symptoms and they must be attended to by an expert rather than self-treatment or over-the-counter medicines, or you think that it's part of the game with the aging, but actually it might just be the tip of iceberg. You might be headed for a complication.
Well, that was amazing. What a great knowledge we got today. Thank you so much, gentlemen, for being here. We are very glad to have both of you.
Thank you so much.